Yeah.
Okay, excellent. So obviously, how we're going to do this. So start with the topic. Obviously, what we're going to cover tonight, we're going to look at how you exercise if you do suffer from arthritis, or if you feel you're going to potentially suffer from arthritis in the future. Just a quick overview of what is to be expected when this works. There we go, that's better. So I'm just going to give you a quick overview. Effectively today, I want this to be as interactive and as enjoyable as possible. Obviously, if anyone has any questions at any point, please just fire them at me. There'll be time to answer questions at the end, but like I said, I know some of what I'm going to be covering is going to be quite complex. So if you do have any questions, just let me know. So we're going to go over just a basic definition, obviously introduce the topic, the causes of arthritis, how this can affect your movements and daily activities. And the most important thing we're going to look at is how do you exercise effectively if you do suffer from arthritis. So first things first, what is arthritis? In a nutshell, it's a degenerative condition which attacks the structures which help cushion and lubricate the joints, which causes pain and swelling, as you're probably already aware. The two main ones I'm going to look at tonight. We're going to look at osteoarthritis, which is the most common one, which is a roughening and a degeneration of the cartilage. And then you've got rheumatoid arthritis, which is a degeneration of the smooth layer of the ending of the bones. And this is actually caused by an action of the immune system. So if anyone has got rheumatoid arthritis, that is generally what's prevalent. Now the basics, as most of you are probably already aware, it is more prominent in older populations. Just gonna let Helen in. Come on, where's it? Oh, there you go. So the most common areas affected, you're looking at pretty much every joint you normally would use in everyday life. So you're talking about your knees, hands, spine, and hips. These are all can be affected by arthritis, depending on what your activities are, etc. Obviously, common symptoms, pain, locking of the joint, instability, and swelling as well. Obviously, if I'm going too fast, please tell me and I'll slow down. Obviously, the joys of having coffee before a presentation. Now, the causes of arthritis, they are hereditary. If you have a history of arthritis in your family, there's a high risk you may get it at some stage in your life. Obviously, it's not gospel, but that's the general consensus. If you have a history of partaking in high-impact activities, sports that involve running, combat sports, throwing sports, sports that involve high repetitive impacts through the joints, that's going to take its toll on the cartilage and the joints. An overuse of the joint, if you are somebody who uses one joint over and over and over again for a very long period of time without letting it heal, then that's going to have a negative effect on the cartilage and the cushioning of the joint. Carrying too much weight, again, probably some of you may have heard this from someone at some point. Obviously, if your body's used to handling a certain amount of weight and you are exceeding that, that's going to cause an excess stress on the body and the joints, and therefore your joints are going to take the toll for that, if that makes sense. Joint instability and hypermobility. Now, this is an interesting one, particularly with women whose body changes to allow for childbirth, etc. Some areas of the body do become lax and more mobile, hips in particular. But think of it like this. Now, you're going to hear this a lot from me in this presentation. Stability is massive in preventing arthritis. The more stable the joint is, the safer the joint is. If you suffer from hypermobility, your joint is effectively a lot looser, i.e. in the joint, there's more room for the joint to rub and wear away of the cartilage and the meniscus, if that makes sense. So it's loose, it can rattle around and actually create more of an erode on the cushioning. and age as well. I mean, without being rude, the older you are, the more miles you have on the clock when it comes to your joints. There's going to be more wear and tear prevalent in your joints, obviously depending on activities, etc., what you've done in the past. And obviously that. Don't ask me how you do that, but obviously I don't think that's beneficial for anyone involved.
I think we did that in mobility on Tuesday, didn't we? It was something like that.
Well, you didn't hear that from me anyway. I mean,
well, I don't know. It kind of felt like that when you're trying to untangle yourself out of the pretzel.
But I say, if anyone can actually demonstrate that and coach that, they can have my job. Kev Thomas. So, how can arthritis affect movement? There's always a delay. Come on. Sorry, it's not responding. There we go. So, a degeneration of muscle mass around the joint. If you think about the actual meat of a muscle being like a wall around the joint, obviously, if you suffer from arthritis, that muscle mass does deteriorate. So you don't have that sort of effectively cage around the joint, keeping it locked into place. And with degeneration of muscle mass becomes degeneration of muscle strength. The muscle isn't strong enough to keep the joint under control. And again, the stability will go with it. I mean, common symptom of this, I don't know, obviously Sue or anyone else here who does suffer from arthritis. Does anyone experience any instances of the muscle buckling or giving way?
Yeah.
Okay. So that might be a case of obviously a degeneration of the stability and the strength around the joint. Obviously joint locking and grinding, again, can anyone relate to this?
Yeah.
At the moment, my knee is locking a couple of times a day.
Okay. How do you sort that, Sue, just out of curiosity?
Just say, oh, bloody knee, ow, ow, and sort of sit down and move it around. If it's in bed, it's worse. It's more painful.
Okay.
Sort of a bit like a cramp. But if I'm moving around, I've got to be careful. Like if I'm walking down the stairs, now I always hold on to the banister because I'll step down to go down and it'll just go and collapse underneath me.
Okay, so you don't have like a routine or anything to stop that effectively?
No, it just seems to come and go. I've had it for ages, and the last 2 or 3 weeks, it's sort of some days it's 2 times a day, and then other days it's nothing at all.
Okay, interesting. Well, like hopefully with some of the information I'll give you in a little bit, that might help. But let's find out. And obviously, goes without saying, with all that going on, there's probably going to be pain when you're moving, and particularly in cold weather, as we discussed the other day, Sue.
Yeah.
Okay, so here's the main bit we're looking for. This is sort of like the main meat of the session. So here's the key factors we want to look at when exercising with arthritis. And the first thing, go away, Siri. How you warm up. Now, this is very, very important. I'll go into the main bits of this in a second. And obviously, what exercise you choose to put into your program. And obviously, the myths and misconceptions when it comes to exercise with arthritis is resistance training can be bad for the affected joint and can make the condition worse, which is actually the contrary. Resistance training actually helps builds that strength, builds that protection, that stability around the joint. Think of it like rebuilding the foundation, so to speak. So the stronger your joint is, the more support it's got. And stronger muscle, it's more robust, it's more resilient, it can take more, it can handle more stress without it causing damage. I think probably the best way of putting it. And with that comes reduced risk of injury to the assisting joints. Now, this is the point I'm going to be banging you guys over the head with for the next 20 minutes is looking at the supporting structures around it. Obviously, if you've got an affected area that's weak from degeneration, the surrounding structures as well. Take your knee, for example. If your knee's weak, the risk of your ankles or your hips or even maybe your back, depending on certain things, could be at risk due to the knee not doing its job properly because it's degenerating, if that makes sense. Is there any questions so far? Or did that sort of go through okay?
No.
Yeah,
No?
all makes sense.
All makes sense, that's good. Obviously, a man doing a pistol squat. Okay, so we're warming up. Obviously, the key considerations we want to look at. I think the most important thing we want to look at is increasing the blood flow. So whether that's 5 to 10 minutes of doing very, very low intensity cardio, literally just getting the body moving, getting the temperature up, and putting blood to the affected area. Obviously, the body's warm. Obviously, the circulation increases, which means more blood can go in, and the healing process can kick in. And you want to improve the production of what's called synovial fluid. Now, synovial fluid is your body's WD-40, so to speak. It is the natural oil lubricant, is probably a better word, between the joints. Now, with gentle movement and specific mobility exercises, you're going to increase the production of this. So have any of you ever done like a mobility exercise where the first few reps or the first set is normally very tough, but once you've done the second or third, it feels a lot looser?
Yes.
Yeah.
And that's as a result of the blood flow and also the production of the synovial fluid lubricating the joint. The other thing I want to look at is activating muscle stabilizers. So you want to look at switching on or priming the structures which help support the injured area. So I'm going to use knees because knees are probably one of the easiest ones to describe. You want to look at switching your hips on, switching your glutes, making sure your ankles are stable, your VMO, which is the main stabilizer of the knee, making sure those areas are warmed up and ready to go so that they're all alert and helping your knee do what it needs to do, if that makes sense. And the most important thing, take your time with warming up. Obviously, with older populations, it takes a little bit longer to get things moving. So in BFIS case, what I probably recommend is if you spend 10 minutes warming up before a small group class, if you need that little bit more time, maybe come 5 minutes, 10 minutes before the class and do some gentle movements just to help get things moving, if you catch my drift. When it comes to exercise selection, now this is quite an interesting one. What I'm going to throw at you is the game is the same, but the rules are slightly different, okay? So by that, the most important thing is you want to keep your injured area as strong as physically possible. So whether that's using your main lifts, so squats, your deadlifts, your push-ups if you can handle them, etc. You want to use that to keep that area as physically conditioned as possible. And obviously, if you have arthritis in a certain area, you might want to look at some specific areas to hit that area specifically instead of working several muscle groups. So for example, if you're talking the knee again, you want to do some specific areas to help strengthen the muscles directly above the knee, just to keep everything in place. Keep the joint mobile. Obviously, if the joint moves better, then it's not going to be as stiff, and you're going to be able to move a lot more free. Goes without saying. And keeping the joint stable. Like I said, if your joint is stable, it's locked in place, whether it's through the muscle surrounding it, but obviously the internal sort of your body's natural awareness as well. I'll talk about this a little bit later. But if your body is aware, it's well balanced, then your joint is locked into place. Now, the key things when actually training is making sure you're working through a comfortable range of movement. So, for example, taking a deep squat, for example. If you can squat deep, that's great. But if by the end of it, you need to sit down for 2 days because your knees have swollen, your hips are swollen. That probably tells me that that range of movement isn't beneficial to you and is causing more harm than good. Which again brings me on to point number 2. If it causes pain, if it does cause pain, and we're not talking muscle pain, we're talking within the joints, leave it alone. Don't worry about it. It's not worth doing it. A little often method. Now this is quite an interesting one. With arthritis, the key thing is you want to keep yourself as mobile as possible. So I would rather, hypothetically, that if you were to train, if your body can handle it, if you could train 5 days a week at half the intensity and maybe for half the time, that would probably be more beneficial to you than training 3 heavy sessions a week, but you've got to take 2 days in between because your body's absolutely blown out as a result. Does that make sense?
Yeah.
So keeping active is the goal as opposed to pushing the tempo, so to speak.
Mm-hmm.
And obviously, no pain, no gain, probably the most toxic cliche, I think, when we're talking about arthritis, because the term pain is a very subjective thing. And yeah, no pain, no gain is a big, big no-no when we're dealing with arthritis. So ignore it. If anyone says that, leave them alone. Things to avoid when you're dealing with arthritis. Obviously, I've just mentioned this: excessive intensity or training volume. So obviously, if you're trying to train too hard or you're trying to train too much and it's causing a injury response, then you need to dial that back a bit. High impact exercises, plyometrics, anything that involves jumping, running, and I've heard a few people use going for a jog and stuff like that who've got pain in their knees, for example. I highly, guard against going out for a run if you've got arthritis, say, in your knees. If your joint is already sort of declining, pounding your joints by going for a 3K run probably isn't the best idea. Go for a cycle, go for a swim when they open up, etc. And again, avoid aggravating exercises. So any exercises which cause, pain and discomfort afterwards, leave it alone. Don't worry about it. It's not important. We're not training for any sport-specific event, so it doesn't need to be in there as far as I'm concerned. And with strength, obviously, as I mentioned, creating physical protection around the joint, we all know that. The stronger the muscle is, the more efficient it is, the more movement it can do, the more controlled it is. So it's going to provide as much sort of security around the joint as much as possible. And of course, a stronger muscle is going to create more stability. Now, I'm just going to stop for a second, and I just want to see if anyone can contextualize these pictures I've just put up. So does anyone understand what these pictures are meant to represent? So I'm going to give you just a minute or so just to have a look and see if you can understand these pictures or what this has in relation to what I'm talking about.
There's no weak link. Everything's working together, strengthening each part.
Yes, you're on the right path. You're very much on the right path. How about the Smurfs?
Not a strong link.
What was that, sorry?
They're not a strong link. They're struggling. They are. They're struggling.
Again, you are on the right path. So what I'm looking at here, so obviously when we're looking at, say, the tug of war, for example, this is an old analogy that in a tug of war, if one person is slacking, then the rest of the team have to pick up the slack to create to win effectively. And your body's exactly the same. If you've got a weak joint, the surrounding structures have to overcompensate to pick up the slack of that weak joint, so to speak. And again, that goes with the chain. Movements are in a chain. So for example, if you're doing a squat, you're working your ankles, you're working your knees, you're working your hips, you're working your back, for example. If one of those joints is out of whack and isn't doing what it should be doing, those other joints have to do extra, which if you think about it, that could mean more injury to those supporting structures because they have to do more work. And the other point I want to look at is if you have got someone that's got, sorry, let me catch my train of thought. If you have got an area that is suffering from arthritis, take the knee again, check above and below. So how strong is your hip and how strong is your ankle? Because you might find that there is a weakness there as well. Just FYI. Now, obviously, when developing strength, we're going to look at the knees, for example. A box squat is probably one of my favorite exercises for strengthening the knees because you can control the depth. So obviously, for those who can get away with squatting a little bit deeper, you can use a shallower box. For those who are a little bit more have knees who are a little bit more sensitive, feel free to use a higher box. Terminal knee extensions, Sue and Anne, I've used these a lot with you. These are very good for building what's called the VMO, which I mentioned earlier, which is the main meaty muscle that travels alongside the knee, which helps keep your knee in place and stable and strong. And the monster walks here, which is a good exercise for working the glutes. I'm sure a lot of you ladies have done this in women's fitness with me. If one of the main reasons the knees get injured is because the glutes aren't strong enough. So that relates to the above and below situation. If your hips aren't doing their job, then your knees are going to take the slack. Obviously, when you're looking at hips, for example, seated leg lift, we've done a lot of this in mobility, but it's a good strength exercise as well. So working on flexing the hip. Obviously, a glute bridge, you're looking at extending the hip and strengthening the glutes as well. You're straightening from both ends. And you've got a banded dead bug as well, which is good for, again, improving the strength of your hip flexes. Is everyone with me so far? I'm just literally just giving some examples of the exercises that would be useful.
Sorry, Simon, quick question.
Yeah.
These exercises can all be used as prevention then, right?
Yeah.
Okay,
yes.
Cool.
These are all exercises I would recommend that you use. I mean, obviously there'd be a screening process beforehand because obviously different people react to different things. But these all should be relatively safe, providing, like I said, the technique and everything is there. So obviously when we're looking at the back, for example, obviously a good morning, controlling how you bend at the hips. This is actually a W. Oh, no, it's actually a V, sorry. But again, this is looking at strengthening the middle of the back. And then the dead bug there, you're looking at strengthening the core as well. So you're looking lower back, middle of the back, and the core to help support the strength of your back. Now with mobility, what we're looking to do is we're looking to keep, again, the surrounding area and the injured area as mobile and as freely movable as possible. Because at the end of the day, like strength, if a muscle doesn't move properly, then the surrounding areas will pick up the slack. So we need to make sure that all the structures that are involved can move as well as possible. Like I said, relieves the stress on the affected area, so there's no compensation patterns, etc. And also helps lubricate the joint. Obviously, if you practice mobility, you're going to help grease the joints. They're going to be able to move a little bit better, and therefore you're not going to get as much grinding, locking, etc. So again, we're looking at the knees. Again, we'll go with the above and below scenario. So the knee to wall, this is a great exercise to help mobilize your ankle. The knee slides. Now, Sue, this might be a good one if your knee starts locking. So laying on your back and just trying to pull your heel in towards your bum. And anyone else who gets that sort of tightness in their knee, that might be a good exercise to do. And the fire hydrant, we do a lot of these. These are great for improving the hip rotation. to the hips. Oh, sorry, gone too far. So obviously you're looking child's pose. Again, you're looking at getting the hips mobile here in hip flexion. Knees to chest, exactly the same thing. So you're looking at improving how your hips flex, and you're looking at internal external rotation as well. So you've got that full rounded movement of the hip. Does everyone understand these exercises? I think we've done these in mobility in one way, shape, or form.
Yeah.
So these are just examples. Obviously, there's loads of different exercises out there, but these are good ones just to, you know, for warm-ups and mobility-based training. And obviously the back, running out of time. Oh, well, that's gone quick. So you're looking at the happy cat, angry cat. This is a good mobility exercise for the entire spine. The prayer stretch, which is good for your upper back, like the thoracic spine, so above. And the pelvic tilt, which is good for hitting the lower back as well and working the pelvis. Now, stability, and that's probably one of the most important ones as well, because improving your stability when it comes to arthritis is you're improving your body's subconscious ability to brace itself and its awareness effectively. If you take an example like walking, for example, when you put your foot down on the floor, do you consciously think on how your foot lands, where your knee is, what your hip is doing, and what muscles are working? No. Your body already is aware of this. But if you suffer from arthritis, this ability degenerates. It becomes deadened effectively. So we need to retrain that. Now, a simple drill we can do, I'll show you in a minute. So obviously, if you improve your stability, it's going to reduce the strain on the main joints. It's going to be locked into place. Now, here's a drill for you. Here's a test of your stability. We've only got a little bit of time, so I won't take too long with this. Everybody, take your shoes off if you've got them on, and I want you to stand up.
Simon.
Go on, Hugh.
Oh,
Take your shoes off.
no. Oh,
Right then, now here's what we're going to do. I'm going to set a timer for 30 seconds, and I want you to stand on one leg, okay? So set yourself up. 3, 2, 1. Let's go.
Falling over already.
That's it. So try not to use any assistance. 15 seconds, hang in there.
I'm lost.
So 10 seconds. Okay, relax it there. How many of you, just by a show of obviously agreement, how many of you found that challenging?
I'm right on one leg, with my other leg, I wouldn't last a second.
Okay. So quite a few of you, is that quite a few of you? Obviously, I've still got my screen shared,
Yeah.
so I can't really see.
Oh, yeah.
So quite a few of you found that quite challenging.
Yes.
So that tells me that we need to spend a little bit more time on improving the balance around the, on standing on one leg, for example. But if you get this in context, obviously with arthritis, if your balance isn't very good, then your risk of, like I said, that joint being insecure is going to be a lot bigger. So just a little bit of fun, just so you got an idea of what I'm talking about. Now we're talking about obviously stability. We just done the single leg stand. If you want to make that even harder, there is a way of doing it with just your eyes closed. And I tell you what, that'll open you up a treat. But we'll have a look at that in a mobility class actually, because I know I've got about 6 minutes left. So I'm just going to fly through this. So obviously you've got a single leg balance, which is a good exercise for your knees and your hips. A single leg hinge, which is where you're standing on one leg, but you're tipping over, trying to reach the floor with a straight back. Again, it looks easy, but if you've done it mobility, it's a lot harder than it looks. And a banded fire hydrant is a good one for strengthening your glutes, which will help keep your knees and your hips in line. Obviously, when we're talking about stability of the back, Obviously, a plank. This is called anti-extension because the aim of the game with holding a plank, you're trying to avoid your body straightening out. So you're trying to not keep the back rounded, but you're trying not to collapse through the front of your body. So putting your body into what's called flexion. Extension, sorry, wrong one. The deadlift, on the other hand, is the exact opposite. You're trying to fight against your back bending. So you're trying to keep your back as strong as you can whilst picking a weight up off the floor. Then you've got the Parallel press here. Parallel press here, which don't think many of you have done. Some of you might have done this in a small group, but the aim of the game is you're trying to move the band in and out without twisting. So you're trying to avoid that rotation of the core. So these are all exercises which are, trying to fight any unnecessary movement, if that makes sense. Is everyone with me so far on that?
Yeah.
So obviously just a summary here of everything we just talked about today. Obviously take your time warming up. Obviously take as long as you need to get your body moving, warm, and ready to go. And again, avoid any aggravating exercises. If it's causing you pain, get it out of your program immediately. Obviously, prioritize building muscle strength and stability on the actual main muscle and the muscles which help surround the joint. I think the most important thing is don't overdo it at the end of the day. Like you said, training hard 3 times a day and then having 5 days of, well, not 5 days, sorry, 2 days of immobility is probably not going to be beneficial to you. So like I said, the little and often method is probably the best way of doing it. Any questions? Nope, nothing at all.
We've been doing like specific mobility classes for this.
What's that, Lindsay?
Will you be doing mobility classes specifically for prevention of arthritis, or is it all?
Not specifically for arthritis. I mean, Kev will probably be watching this, so I'm sure I can relay the question to him. But at the moment, the mobility classes we're doing are purely just generalised.
Well, they fit in, Linz, with the small group. Simon does it with me already, but this is why I do box squats, because of my knees. So
Yeah.
we get it tailored into our small group programs.
Small group. Yeah.
Yeah.
Lots
Oh no, I've been doing it. Well, I've only done one for months, but Naz is sorting some different things out. I bought loads of the little bands with the intention of doing like the shoulder one, the knee, so hopefully. Yeah.
Well, like I said, Lindsay, if you have any questions on any specific, and this goes for anyone here, if anyone's got any specific questions on specific exercises they've got for whatever conditions, drop them on the BFit clients page and I should be able to answer it.
The only one I had was the one I asked about, why does it feel worse in bad weather? And David Llewellyn sent a really comprehensive answer to that. So there's lots of reasons why it probably does feel more painful in cold weather. One of them being that you're more tissues and things are more sensitive in cold weather. And another one being that you do need to warm them up a bit more. So if it's a bit colder, you need to do a bit of a longer warmer.
No, absolutely.
So when I come back to be fit in the winter, I have thermals on my knees.
That's the thing as well. I mean, wearing a brace around the affected areas is also a good way of doing it because you're keeping it warm, which increases the circulation around the joint, which means that blood flow is going to get in there, and it's going to, reduce the risk of inflammation, etc.
Yeah, it certainly helps me. I know that. Yeah.
Yes, me too. It does in the cold weather. I put it on because it's much warmer and it moves quicker. As you say, the blood flow moves around quicker. So your mobility, I feel it's more mobile a lot quicker.
That's good. So, ladies and gentlemen, I don't mean to cut you guys off, but I've got just under a minute left on this presentation. So, I'd just like to thank you all for coming tonight and listening to what I had to say. If you have any other questions, please drop them on the Facebook page. But have a good weekend, and I will see you guys.